Good afternoon. Welcome and thanks for joining us for today's HIS Talk webinar, How Hospitals and Practices Can Respond to Consumerism by Better Engaging Patients Through Price Transparency and Payment Options. It's brought to you by Change Healthcare. I'm Lori from HIS Talk and I'll be moderating. We have two speakers today. First up will be Linda Glidewell. Linda is the Vice President of Business Development for Consumer Payment Solutions at Change Healthcare. And joining Linda will be Kathy A. Moore, MBA. Kathy is the President at Moore Martini Medical. And with that, I'll turn it over to you, Linda.
Thank you. So thank you for joining us today. We'll be covering some background and overview of consumerism and talk a little bit about consumer frustration and confusion and how that impacts revenue cycle performance. We'll talk about the problems today, most of them you're fully aware of, emerging industry consensus from one of the recent surveys that was conducted, and then turn it over to Kathy to really focus on, from a provider perspective, what some of the patient focus initiatives are, results, and lessons learned. We'll leave time at the end for questions and answers. So just a little bit about who Change Healthcare is. We're one of the largest independent healthcare technology companies in the U.S. With the recent merger of Change Healthcare, formerly known as MDON, and McKesson Technology Solutions, we have 15,000 team members with over $4 billion in revenue. We process over 2 trillion healthcare claims and are connected to over 5,500 hospital and health systems. Our suite of revenue cycle solutions can help empower providers' financial priorities across all of the patient journey. It starts with the eligibility and estimation, then claims and tracking, rejections and denials, payments and billing, and reporting and metrics. We'll be spending a lot of our time later today on the eligibility and estimation. So just to give you a little background, all of you know that U.S. healthcare spending has continued to grow, was estimated at $3.2 trillion in 2015, 18% of GDP. It's expected to grow to $5.4 trillion or 20% of GDP by 2024. You can see from this slide that a lot of the input now into the healthcare payment system is coming from consumers. So consumerism is really changing the game. It's driving an increased volume of payments from consumers. We saw over a 6-time growth in high-deductible health plans over the last 10 years. There's an estimated 16.3 million in future total marketplace enrollments. So the result of that is about $350 billion in total consumer payments in 2015. And the impact is that providers are really having to focus more on engagement and reimbursement models, payment and collection strategies, while continuing to be conscious of compliance and regulatory complexity. Consumers throughout are demanding more of a simple retail-like experience. So we can see out-of-pocket continues to grow for consumers. So it started at about $29.2 billion in 2011 and is projected to be $43.2 billion in 2021. And we look at high deductibles, and each of us that are probably going through that enrollment process now are seeing those deductibles rise, and out-of-pocket costs are continuing to grow, with some family plans having $10,000 or more in deductible. So what does it mean to the consumer? Consumer financial responsibility is just continuing to grow. They're learning how to manage, they're trying to shop for care and services, but the tools are minimal and not easy to use. Less than 1 in 4 consumers are even prepared for any financial surprise over $1,000. And again, they're really looking for it to be simple. They want to be able to have the same choices and the options that they have with other industries. They want it to be simple, like Amazon or PayPal. And then they have to consider, who do they trust and for what information. So I wanted to share just a couple of snippets from a recent survey that was conducted and commissioned by Change Healthcare with ORC International. And so it really shows that providers and payers are investing heavily in consumer engagement tools. And providers, 72% of the providers surveyed state that it's their top priority, and 80% for payers. And this is continuing to be driven by value-based care, the consumer demand, and competitive pressures. So what also came out of this survey is that from a consumer perspective, only a quarter or less really saw improvement in any of these areas. And so on this slide, you can see that they did see 25% improvement in health and just less than that in ease of getting appointments. But others were falling less. We actually surveyed about 14 points in the original study, and these were just highlights from that study. So we know what the challenges are. It was interesting to see how they stack up. Again, with providers surveyed 61% and 54% of payers said budget constraints continue to be the #1 challenge in meeting their consumer engagement goals. Managing the complexities of implementation fell #2, and then just having to manage all the multiple systems across providers that are not necessarily talking to each other in an operable way. Providing an ROI, knowing that it's the right way to go. Consumer engagement is a key priority, and there's a lot of expense and resources, but really proving the return on investment. So the overall impact, I wanted to focus on the lower half of the slide. We know that you and I, as healthcare consumers and patients, we may have a really excellent experience with our healthcare clinical experience. So the doctor may have been great, the nurse was wonderful, our outcome was exactly as expected. However, if we're not satisfied with the billing and payment financial piece of the experience, then we found in studies that 33% that were unsatisfied with that billing experience are only 33% actually paid their bill in full. If they're satisfied, 74% paid. And it also impacts whether or not they would return for service. So that very last part of the journey is extremely critical as far as patient satisfaction. So if we look at this from multiple lenses, from a consumer standpoint, they're really looking for less complexity. They want more choices. They're footing more and more of the bill. Many consumers are willing and able to pay, but the healthcare bills are complex, or they may not understand what's owed, or information is not available at point of care. The bills are often processed at different times from different sources and even from the same episode of care. And there's confusing terminology. There are various acronyms that are used. The information may be incomplete and formats are inconsistent. We found that consumers trust the EOB and their payers more than they trust the provider bills, and most of them will match their bills back to the EOBs and often will hang on to those statements. The average is 3.2 statements are printed before a patient actually takes any action, and it kind of sits in a pile, and then they get to matching up the EOBs and decide what they're going to pay. And they expect, again, that very simple, easy, transparent experience, and multiple payment channels are especially important. Not everyone responds, reacts, or pays in the same way. From a provider perspective, they really need easy to deploy and implement tools for patient collections and for engagement. They can no longer afford for patient write-offs to continue. They really struggle to collect from patients at the time of care, and they need ways to effectively engage the consumer, both from a finance perspective and a health perspective. Collection costs are long and costly, and the revenue cycle is longer for patient collections. And from a health plan perspective, they're really looking to provide more value to the consumers. They want to enhance the engagement experience. They want to be different from the other health plans. They're threatened by new business models, including ACOs and in-house health plans, and they're trying to reduce the cost of communication to be able to compete more effectively on premiums. So with that, I really want to get to the meat of this discussion and turn it over to Kathy Moore with Moore Martini Medical to really focus on patient payment and patient engagement initiatives and what's working for her. So with Kathy, I'll turn it over to you.
Thank you very much, Linda, and thank you everybody for joining us this afternoon. My name is Kathy Moore, as mentioned. Our company is Moore Martini Medical, and we have been proudly able to be a part of the Change Healthcare experience since 2012. It's been a very profitable arrangement and engagement. Next slide. What I wanted to focus on this afternoon is really understanding the revenue cycle management process, and it starts with the medical claim preparation and better patient engagement. Claim preparation is not going to be successful if we don't prepare. Next slide. So let's focus on some housekeeping items. Patients need to know what they owe. This is, as we know, very important. How can providers help? First of all, understanding your patient's medical insurance. Number 2, focusing on patient transparency and communication. Number 3, offering different payment options and methods for engaging with the patient early on in the process, and centralizing the revenue cycle management process. Next slide. So let's think about how patients envision their whole experience. When I was in graduate school, I actually took a class in consumer buying behavior, and what it basically was the psychology of buying. And patients really do have a psychology of buying. So in this slide, we actually wanted to give a visual of how patients think about their healthcare plans and engagement. And so first on this slide, you can see the thought about money. How am I going to pay for this? Different things about what's going to happen at the employer level, what's going to happen at my level. What's going to happen if I have to do other things as it relates to traveling or engagement in other parts of the world, and hospital versus going to the doctor. And lastly, what are other modalities that my employer allows for me to utilize to pay for my healthcare coverage? HSA, HRA, FSA, breaking down these acronyms, health savings account, flexible spending account, and also the health reimbursement arrangement account. These are important because these are modalities that patients can actually use to pay for their health care, and we see this every day. Next slide. So let's break it down even more. Employers may offer more than one health plan, or you may be able to shop for your individual health plans, again, if you're self-employed. Either case, consumers will have a choice. There are many things consumers, again, think about, which we just saw when making health plan choices. Just again, breaking it down a little bit more, will you be able to see your doctor, your regular doctor? This is extremely important. As Linda indicated in the previous slides, patients have a certain comfort level. They like to stay with who they know. Will it cover the care you need? And maybe most importantly, how much again will it cost? Medical premiums aren't the only cost that patients think about. Types of plans differ in how they give you access to care and how they are set up as it relates to cost. Before patients choose, and even you as a potential patient, make sure you know what's covered and what it costs. Many times in our business, working with providers and working with patients, we really want to give a visual experience for both. You would be surprised how many patients really don't understand their medical insurance. You would think it would be something that's very well understood, and it's not. So many times, and you'll see this through the rest of my presentation, we'd like to give the patients a visual experience as it relates to everything as associated with their health care. So even being able to show them how to understand their medical cards. Medicare recipients, which are patients that are 65 years and older or disabled, are coming in with their Medicare cards. And many of them don't even understand how these Medicare supplemental or Medicare primary plans work. Patients that have primary medical insurance, such as you see here, Geo Blue, part of Anthem, again, we really like to explain to the patients what their medical insurance cards mean and how they work. Also indicating to the patients the type of insurance that they have. Many patients don't understand the difference between PPO, patients don't understand EPOs, they don't understand any of the type of insurance plans that they actually are being, that they have in terms of delivery from their employers or even self-employed. So I thought this might be a nice little intro slide to talk about, again, the visual and the experience from the patient's perspective. What if you dropped off your car and the mechanic didn't receive an estimate, and you didn't receive an estimate prior to the work being completed? And I love this slide because you can really see the gentleman that's making the payment really confused. He just does not understand. Even though it's visual, he just doesn't understand. So the gentleman in the slide is actually going through and it's showing him. And again, that's going to lead right into our slide deck that's coming up. It really is important to have the patient have a visual experience. Next slide. In our organization and with our providers and with our patients, the first step is going to be correct eligibility, and then moving on to the estimation of cost as it relates to their treatment plan. Our facilities are seeing an increase in revenue due to understanding billable surgical Medicare procedures within their practice or medical procedures. Eligible Medicare and properly assessed non-government carriers, eligibility check specifically, has simply led to less out-of-pocket expenses for patients. They're very simple to understand, and use of the Change Healthcare eligibility tool has truly led to fewer claims denied for our physicians and more importantly for the patient. Again, this visual experience is very important, and it's very simple with the Change Healthcare patient estimator as well as the eligibility check. Next slide. This is an example of a patient eligibility. And you can see that the way it starts is that the patient has an accurate understanding. If you can go back, please, Linda. The patient can visually see themselves. They have a breakdown of their plan. It shows their address. It shows their employer. So again, they can relate it to being their plan. Next slide. It continues down, showing the patient out of network and also in network. From our relationship with patients, we are just sometimes dumbfounded that they do not understand the difference between out of network and in network. They really don't understand that. So with this breakdown that they can visually see, again, 80% of what people see is what they truly understand. They really understand that if they're dealing with an out-of-network provider versus an in-network provider. And this is key to them understanding what the cost of their insurance plan or their treatment will actually be. Next slide. Common complaints. No one told me. If only someone had told me what my bill was, what the treatment was going to actually cost. I don't understand what I owe. I'm going to owe how much? What do I have to pay? Again, the patients, many times when they're told what they're going to have to pay, they don't understand it because they don't see it. So moving on to the next slide. And then when they're also given options, just without giving a visual understanding, just told, many times they don't really quite understand it. But prior to us giving them the estimation, we really do want them to understand their patient options. When in our organizations, we break it down into three means of discussion with the patient. We talk about the treatment plan and the cost at pre-service. We let them know that they have options with our practices for using credit card, debit cards, e-checks. We talk to them again at time of service in person, again with the patient estimator, which you'll see in just a minute, showing them how they can, again, use the modalities such as debit, credit, or checks, or cash to pay for their treatment plan. And lastly, post-service, being able to show the patients that we have online portals, reoccurring auto draft payment arrangements can be made with our offices, phone calls via credit card, e-check, phone calls with the interactive voice recognition, lockbox, personal medical alerts, and care credit. Personal medical alerts many times can even come through our EHR portals. Also, we drag back in, as we saw in the slide, one of the earlier slides, reminding the patients that many times for these high deductible plans, they have access to an HSA, which is the health savings account, their HRA, which is the health reimbursement arrangement account, or the FSA, which is the flexible spending account. And then we again move into the other modalities of payment. So the patients really have an understanding verbally of all their patient options. But then moving on to the next slide. The patient estimator really pulls this all together for our clients and for our patients. The patient estimator basically gives them a breakdown of their eligibility, again, reminding them what they had in terms of their employee plan, from a breakdown with the various descriptions of in and out of network benefits, and then taking this patient responsibility program and actually breaking it down even further for the patient. The patient is able to see his or her name, they're able to see their provider, and then it breaks down very succinctly what they have in terms of their out-of-pocket cost for the treatment plan, as well as it including their deductible. But if you can see, I'm not sure if it's very clear in the slide, but if there's one highlighted line where it says the patient's estimated amount, it really clearly shows the patient what they're going to owe based on the treatment plan, which are going to be the CPT codes that are listed below, just giving them a true description of what's being done by the provider and then what the cost, their ultimate out-of-pocket cost for that engagement at that time for the patient will be. So the patient, again, visually sees what they're responsible for at the time of service. Next slide. So scheduled patients. For our practice, we actually have used the patient estimator about 3,000 times. We really work with our larger providers. Our largest provider actually has 11 offices, and it's approximately 30 providers that are part of the practice. And they really are dependent on the patient estimator to be able to help their patients understand visually what their responsibility is as it relates to their treatment plans. For patients with expected out-of-pocket responsibilities, it excludes patients with secondary, excludes patients with Medicaid, excludes any patient military plans. Patient examples, uninsured but not, but now with affordable health care, Affordable Health Care Act, which is still pretty much in play. We're looking at patients, again, with these larger deductibles, which can, as Linda indicated, can be as much as $5,000 or sometimes even up to $10,000 if it's a catastrophic plan. And the patients, again, are able to identify their payment plan opportunities. Patients really can understand how to defer these, won't be encouraged to defer these services because, again, they do understand what the cost is going to be for their scheduled surgical procedures. Next slide, please. As you saw in one of the earlier slides, Warren Martini Medical started our engagement with Change Healthcare in 2012. And one of the biggest challenges that we have had is really the culture as it relates to the physician's office. Physician's offices need to provide correct and applicable codes. Registration staff and financial counselors need to review and understand their collections. Our community is expected to receive estimate costs and expectations of payments. This is, again, really important on the staff side. So with our organization, we spend a lot, or our practices, I should say, and also including our organization, we spend a lot of time on the intake process, as you saw, really working on helping our patients as well as our staff, more importantly, to understand how the patient engagement will start. And that's going to start with the patient eligibility and then moving on to the estimation. Immediate results of provider estimations. Collections truly do increase. Patients begin and expecting knowledge of what their insurance would cover and what their out-of-pocket costs will be. This is true because the patient estimator will pull that in from the eligibility check, and we do have a decrease in AR for cash paying patients. Again, when the patients do understand and can see, they really do expect to have their payments ready, or if they're requested to make payments, they know exactly what they're requested to pay. Next slide, please. So with that, we really do have to spend a lot of time on education. And this is really important as it relates to our staff webinars. We engage with we have a relationship with our organization, with our clients, with AAPC. And so with these webinars, we do truly have the patients understand how the our clients understand, so they can relate it to the patients, how the patient estimator works, how the calculations work, either through manual input or through the electronic modalities that are part of the process. We drive home this understanding through these webinars and these training modalities that we have with our certified professional coders, and we really, really spend a lot of time on scripting, so that not only do the office staff understand, our staff understand, so we can have a better experience for the patient. And we practice, practice, practice. Again, we even have testing that's included in our webinars through AAPC, where there's actually little quizzes for the staff on patient intake. This is really driven from the top with our providers and also with our leadership, with our certified professional coders, because again, it really does make a difference as it relates to the patient engagement and patient experience from a visual as well as an acceptance perspective. Next slide, please. Immediate results. Consistency in pricing, price quotes can be provided. Again, you saw that, I think, pretty succinctly with the patient estimator. Patients better understand financial responsibility because they can see it, it's visualized. Enhanced ability to set payment expectations and request advanced payment arrangements, because again, it is going to be something that the patients can visualize as it relates to the patient estimator. And it identifies uninsured patients qualified for financial assistance. In the patient eligibility, you can truly see if a patient is inactive as it relates to their insurance. We've actually had in some of our really live situations where patients were inactive, and because we ran a patient eligibility, the provider could actually see that the patient no longer had coverage. And in one case, the patient didn't even know that they no longer had coverage. So this is extremely important. Lessons learned: engage all of the appropriate team members and leaders, set guidelines of acceptance versus unacceptable, focus on the importance of customer service, extremely important, and identify super users, people that are really going to engage within the practice, that are really going to engage even as testimonial from a patient perspective, and you test. You test your theories and you execute. In summary, price estimates are not required, but the right thing to do for our patients. Providing estimations with efforts to collect and offering different payment options will increase your collections. This is correct and true. We have one of our clients, again, our largest client, that is now, last year they were doing a little over $2 million. Now we expect to do over $6 million in collections. Estimations with proper scripting will improve your customer satisfaction. When patients do see, they do understand. Challenge yourself. Are your patients satisfied with their current process? How can we modify the process to increase collections? How can we make collections easier for staff? How can we raise credibility regarding our estimates? Do we have the technology necessary to answer the questions above? One thing I can say from a personal perspective with the patient estimator, because we do the billing for a majority of our clients, is that the patient estimator is going to, as time goes on, become approximately 88% accurate in terms of the estimates that are going to be given to the patient. So the trust from not only the patient's perspective, but also from the staff perspective, does increase with continuous use of this modality. And that's it. Thank you very much. Are there any questions?
Thank you, Kathy. Now we would like to open it up to the audience for questions. And as a reminder, you can use the questions section on the GoToWebinar panel to submit your questions to Kathy and Linda. We actually don't have any questions yet. Linda, is there anything that you would like to add to the end of what Kathy just said?
I can add, while we focus primarily on the eligibility and estimation, I touched on a little bit earlier the importance, and Kathy did as well, of having payment options, a number of different payment options. All of us pay differently and we respond differently. And so having solutions that include, traditional mail and pay into a lockbox, for example, automated voice response system, tools where provider staff can take in a payment, and then continuing to go more digital with the online and mobile experience so that you and I as healthcare consumers have those choices where we can easily make our payment from any device in any location. So I think that's extremely important. Of course, we want to collect as much as possible up front, but for any remaining balance, making it really simple and convenient for patients to make their payments is especially important as well.
Thank you. Juliana would like to know, how long does it take to get the software up and running?
It depends on the configuration. Normal implementation time is between 60 and 90 days, but I think for your specific needs, we'd be happy to look at your configuration and requirements and give you specific timeline if you're interested.
Thank you. That was the only question we have, which makes me think you did a great job of presenting a comprehensive story there. So thank you for joining us today, and thank you, Linda and Kathy, for the presentation. As a reminder to attendees, watch your email for links to the recording of today's webinar, as well as the PDF version of the PowerPoint presentation. We look forward to seeing you at our next HIS Talk webinar. Enjoy the rest of your day.